Does muscle weakness exist? Now, straight away you're going to say, of course muscle weakness exists. But I'm going to question you on that because I'm going to say the answer, if muscle weakness exists, is actually yes and no. I'm going to explain to you why. This may ruffle some feathers, but we do need to discuss it. Weakness is a vague and misleading word. It is more of an umbrella term. I want you to consider this. If I say weakness, you will say the solution is to strengthen. That is pretty standard. But what if there's more to it? So let's talk about this umbrella term of weakness. Of course, we understand what weakness is. But as I say, there's more to it because if we are trying to provide a solution, we need to understand it a little bit better. So for me, in almost 2 decades of clinical practice, I have not seen a case of clinical weakness in a healthy person. Okay? Every case that I have seen with clinical weakness has had a neurological origin. Now, if you know me, I am a nerve and neurological focused practitioner because when I teach, I always teach everybody nerve, muscles, ligaments, joints. If we want to start from the beginning, we're going to have a nerve focus. Okay, so for me, all of the cases that I have seen of this weakness clinically, okay, have been of a neurological origin. Now, this is my side of things. When I see a healthy person, sedentary, active, whatever it is, they're a healthy person with clinical weakness. Of course, this is not my area where somebody they're ill in their health and they present with the clinical weakness because, they could have been in a cast for a period of time, so an immobilization, associated muscle atrophy, some type of medical condition. Now, that is not necessarily often within my scope. So, of course, those are forms of weakness we can see, at which point, if appropriate, strengthening may be the solution. And sometimes not. But I'm talking about when I have a healthy person come in with a clinical weakness with or without pain, but they are not injured, there are some reasons for that. Of course, we can have some deconditioning just because maybe a lack of activity, but that's still a relative term because like an unconditioned person that say is untrained, if you want to bench 225 and you aren't strong enough, you are going to exercise to get there. But what the difference is there's no limitation. Like there's no physical limitation in the body as a barrier to getting these where we want to go, and you can strengthen that. But for the people that I see that come in because they have pain, they have an issue, what happens is they are below this baseline and then they do have a barrier or a limitation, and that is with something called inhibition. Inhibition is a neurological term. Often I explain that to patients that it's a signal problem, not a muscle problem. For example, if I see a shoulder issue, I'm going to look at the origin of the nerves, which can be upper cervical spine or scalenes, something that is impairing the signal out to the shoulder or even within the shoulder itself, some type of impairing or neurological inhibition. So this is basically the question I pose today is, with weakness, is the answer strengthening? And I'm telling you clinically, because what I'm saying is it's a healthy person with clinical weakness. That means something that has a barrier, they have inhibition. And you cannot strengthen that inhibition to correct the problem. You may be able to relieve it, but you are not going to fully strengthen that muscle. So in that order of nerve, muscles, ligaments, joints, we need to address the neurological or nerve problem to uninhibit the muscle and get rid of that limitation, bringing that up to a baseline at which point they can be strengthened. The other way I pose this is that even when we want to strengthen something and there is an issue going on, we often still choose an order. I propose an order, and that is stability first, which of course has a nerve origin, pain second, and then strengthening. Okay? But again, what I'm saying is weakness that we see clinically, and I stress this to other practitioners and encourage you to ask questions. Are you weak or are you inhibited? And that is what I teach on my YouTube channel here. If you want to learn more about what nerves are influencing you or what neurological process may be going on, and I encourage other practitioners, and that's what I teach on my courses, is to consider these weaknesses we typically see are not actually weaknesses per se because we cannot strengthen them better. They are inhibited. So for example, if I have a runner come into my office and their glutes are weak, well, they run, they're active, they're healthy, yet their glutes are weak. I will tell you, I have never seen an actual weakness from that. I have always been able to uninhibit that muscle and get them back in order. So I want you to sit with that, think about it, and if you want to learn more, I'll put my resources below.